Today's video topic is, why do you keep getting thrush? Causes, symptoms, and treatment. Thrush is a common fungal infection caused by an overgrowth of Candida yeast. It can occur in various parts of the body, but most commonly affects the mouth and genital areas. While most people experience thrush at least once in their lifetime, others may develop recurring infections. If you're one of those who keeps getting thrush, here's what you need to know. Causes of recurring thrush. 1. Weakened immune system. People with weak immune systems, such as those with HIV, cancer, or diabetes, are more susceptible to thrush. They may also experience recurring infections due to the inability of their body to fight off the infection. 2. Antibiotics and medication. Antibiotics can kill the good bacteria that protect against the overgrowth of Candida, leading to an imbalance in the body's microbiome. Certain medications like corticosteroids and immunosuppressants can also increase the risk of thrush. 3. Hormonal changes. Hormonal changes during pregnancy or menstrual cycles can disrupt the balance of vaginal bacteria and promote the growth of Candida. 4. Uncontrolled diabetes. People with uncontrolled diabetes may have higher levels of glucose in their blood and urine, providing a favorable environment for Candida growth. Symptoms of thrush. The symptoms of thrush can vary depending on the affected area of the body. Common symptoms of oral thrush include white patches on the tongue, inner cheeks, and roof of the mouth, redness and soreness in the affected areas, difficulty swallowing, loss of taste. In women, thrush may cause itching and soreness in the vaginal area, painful urination, thick white discharge. Treatment for thrush. The treatment for thrush depends on the severity of the infection and the affected area. Mild cases of thrush can be treated with over-the-counter antifungal medications like creams, ointments, and tablets. However, if the infection is severe or recurring, it's best to consult a doctor for prescription medications. Prevention of recurring thrush. 1. Good hygiene. Keeping the affected areas clean and dry can prevent the growth of Candida. This is especially important for women who should avoid using perfumed products in the genital area. 2. Balanced diet. A healthy diet that's low in sugar and high in probiotics can help maintain a healthy microbiome, preventing the overgrowth of Candida. 3. Avoid antibiotics. Unless prescribed by a doctor, it's best to avoid antibiotics, which can disrupt the body's natural balance. 4. Manage diabetes. Managing diabetes through a healthy diet and exercise can reduce the risk of recurring thrush. Thrush is a common infection that can be easily treated with proper medications and preventive measures. However, recurring infections may be a sign of an underlying health condition, and it's best to consult a doctor for proper diagnosis and treatment. By maintaining good hygiene, a healthy diet, and managing underlying conditions, it's possible to prevent recurring thrush and enjoy a healthy, comfortable life.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.